So, I am so pleased to have the opportunity to introduce you to our guest speaker tonight. I was so excited about this lecture. So Dr. Rosellen Rosich. Dr. Rosich holds, I'm going to hold this here so that I don't get this wrong, because I really like to get people's bios right, holds the rank of Professor Emerita of Psychology at the University of Alaska, Anchorage. And she has a Ph.D. in lifespan development, developmental psychology. And she also has training in gerontology and holds credentials as a dementia practitioner and Alzheimer's disease and dementia care trainer through the National Council of Certified Dementia Practitioners. So for 45 years, Dr. Rosich has been studying or teaching about the vicissitudes of aging and interpreting research findings into practical applications. So she recently completed being the UAA Director and Co-PI of Geriatric Interdisciplinary Leadership Development Program, Center for Human Development, College of Health. And that was funded by the United States Department of Health and Human Services, Health Resources, and Services Administration under the Geriatric Workforce Enhancement Program. As an independent researcher, Dr. Rosich focuses on the influence of history on human development, Indigenous peoples' perceptions of memory, dementia, health inequities, and genetics, DNA, epigenetics, and their role in lifespan development and family connections. Super excited about this work. And we're so excited to have you with us tonight, and thanks for coming to UAS. I also, even though she told me not to do this, I'm also going to make Dr. Sarah Nico stand up. Come on, doctor. Yep, I'm going to make you stand up. So this is Dr. Sarah Nico. And I made Dr. Sarah Nico stand up, even though she asked me specifically not to do that. That's the kind of dean I am. She asked me not to introduce her, but I couldn't help it because this tonight was her brainchild. See what I did there? Brain. I know, I'm so bad. It was like a bad mom joke. Dad jokes, mom jokes, that's me. Sarah has a flyer with her tonight. And I think, did I bring one up here? So all on the snack table back there, you probably saw these flyers. And Sarah's got some of those flyers on her tonight. And it's got a QR code at the bottom. And you should probably scan that QR code because there's information on that flyer about follow-up lectures to this lecture tonight. So what I thought was so cool about how Dr. Nico proposed this lecture was we'd start with this one and then we would continue this conversation about brain health. And I love that. So the other things that we're going to be exploring, we're going to talk about how gut health can help prevent and possibly even reduce symptoms of Alzheimer's. We're going to explore indigenous ways of healing and health. We're going to explore more lifestyle interventions to promote brain health. And we're going to end, which is so cool, with this expert panel Q&A session with local psychologists, psychiatrists, and neurologists. So if you're digging this tonight, you should come to all of those. So again, Dr. Nico has a flyer with a QR code, so scan that, and then you can know how to attend those. So they're going to be in person, and Sarah, that's going to be in Egan 112 and live streamed except the November 17th, because that lecturer is going to be joining us from the East Coast from Yale. Did I get that right? Fantastic. And lastly, even though they're not here tonight, I promised Robbie Stell that I would talk to all of you about our Alumni and Friends Association because Robbie Stell really wants you all to check it out, join it, give us some new cool ideas about what Alumni and Friends should be doing at UAS. All right, without further ado, Dr. Rosich, it is time. Oh, yes, come on up. Yes. But I also promised Sarah that I would mention our co-sponsors for tonight's lecture. AARP and SAIL helped us sponsor these lectures, and so we at least wanted to make sure that we mention them, that AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people 50 and over to choose how they live as they age, and also SAIL, which is Southeast Alaska Independent Living, empowers seniors and people with disabilities by providing services and information to support them in making choices that will positively affect their independence and productivity in society. They sponsored us with funding for this lecture. So thank you, SAIL, and thank you, AARP. Dr. Rosich.
Thank you very much. Thank you. And thank you all for coming. Hopefully you can hear me all right. I normally don't use microphones because I've got a big mouth and I usually project really well. But since this is video streaming, it's a necessity to do this. You know, one of the reasons I chose this title, the vicissitudes, because vicissitudes in the dictionary could be defined a number of different ways. I used it so that it is referring to changeability. With respect to positive and negative types of impact with respect to aging. It can be used also very pejoratively, and it wasn't my intent to use it in a negative way. But it really is having to do with talking about, which is so critical for us in gerontology and in people in psychology that study the aging process, to have everybody understand that aging is not decline all the time. It's gains and losses. And much of what I'm going to convey to you today is some of the, and I'm kind of coming at this from a multidisciplinary approach, is that we have enough information now to really truly understand what people are going through with respect to the brain. And I'm using a very unusual approach here. I'm going to be talking about the lifespan and why a lifespan perspective is so critical in understanding what's happening with the brain and what's happening overall in the aging process. You know, because what happens earlier in the lifespan really can set the tone with respect to what is going to occur later in midlife and then in older age. And parents very early on have major impact on their children. And we're beginning to really uncover that. So the lifespan perspective, it's going to be different. We're going to talk about some things that hopefully even younger people can relate to with respect to how can you keep a healthy brain? You know, how does the environment impact it, as well as your behavior and as well as what you've inherited, basically, your genetics. But before I do that, I'd like to take this opportunity to really thank AARP and UAS for the development of this series, because I think it's so critically important to let people know you're not alone in the aging process. What you're going to go through is some aspects are universal, some are individual. And I'd like to think too that basically what we're going to be talking about here is going to be encapsulated by the Serenity poem. And so I don't mess it up, I'm going to read it. The Serenity poem basically says this: God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. You know, there's aspects of aging that you can have a positive impact on, but you have to exert the effort to make behavioral change. This is where my training in psychology comes in. So before we do that, I would like to take this opportunity to also thank my lovely mother and father, who are no longer with us, but they're always with me in spirit, and also my ancestors. You know, I feel very strongly, like Alaska Natives, my connection, there's a very strong connection with my ancestors, and one of my hobbies is doing genealogy. I don't know if many of you do that, but there's a connection there. You know, my ancestors, like many of yours, really traveled from one continent to the another before they got to the United States. And, you know, they were looking for a better life, and they found one when they came over in the 1800s and 1880s. And so subsequently, what we're also going to talk about to a certain extent is genetics and the role sometimes the genetics plays. Unfortunately, the research with Alzheimer's disease is indicating there's genetic components with, brain types of degenerative diseases. Those types of things you're not going to be able to change very much, and you're going to just have to try to adapt. But we're going to make a distinction here, hopefully, for you. So thanks to all those wonderful people that provided me guidance, love, and support in my own life. I feel when I got my Ph.D., it was not an individual degree, it was the families. They put up with a lot. So also, I think we're going to see here, hopefully, as I said, the importance of parents, which is really very important to me with respect to my lifespan focus. A recent study published in the Journal of Eating Behaviors indicated that both parents, and this came out of Amsterdam just recently, both parents play pivotal roles in shaping their children's health behaviors very early in life. Now think about this. If they're shaping their health behaviors, eating behaviors as well, very early on in life, that is leaving a neural trace, because eating, as you'll learn about from Dr. Kane, really has, and the gut biome, has a lot of influence with respect to the brain. And so you're certainly going to see more with her with that deep dive. But I want younger people to realize that, your parents are wonderful people, but they've been socialized by their parents, and they in turn have picked up values and belief systems, eating behaviors and health behaviors, which really have impacted them. Maybe it might help also starting with a story. The story I have is from a personal experience when I was a child. My mother, when my father wanted chicken, she would make chicken, and she'd make the chicken for my brother and my father, but she'd make me and her pork chops. And I was like, well, that's kind of interesting. She's making 2 meals. What's going on here? So I got to be about 8, 9, or 10, and I went to my father, and I said, can I ask you a question? He said, well, sure. My parents always encouraged intellectual engagement and for us to ask questions. And I said, well, how come when chicken is on the dinner table, we're also having pork chops? And you and Pete eat chicken, and Mom and I, eat pork chops. He says, well, I can tell you this. He says, when your mother has never eaten chicken since she was a child because she was traumatized as a child. And I said, well, that's interesting. My Italian grandparents immigrated, came over from Italy, went to New Mexico, then Colorado. Then, they were really used to subsistence lifestyle. In Italy, they were growing grapes, and they were raising sheep and chickens, And so then they moved to Cleveland, the big city. And so they missed having fresh meat, fresh chickens, And so she took my mother down to the market, For most Europeans coming over, they love the open markets. They get fresh fruits and vegetables, fresh chickens. But the chicken would be prepared right there. It would be dismembered. And my mother was very, very young, And she's about 2 or 3 years old. And we now have enough evidence to indicate that children of that age have neurons, that quite a few of them. I think by the age of, when they're first born, they have about 7,000 neurons. By the time they're 2, they have 14,000 neurons. And so they're interacting with the environment, and this information is coming in, and it's really having neural traces, pathways in the brain. And she saw this chicken being dismembered, and it completely freaked her out. She was traumatized. And so he said, to this day, she doesn't eat chicken, and she won't eat chicken because it was so traumatizing. Of course, I had to think about that because, my father was also the person that told me the story of when he and my maternal grandmother were teaching my mother how to drive. So they come from northern Cleveland, and up in Cleveland, and they go south they figure, this is the 1948, 1949. It'll be safer for her to learn how to drive, in Amish country, where there's, horses are drawing the wagons. And so she gets behind a horse-drawn buggy, actually, not a wagon, and suddenly she slams on the brakes. So my father goes to her. He goes, after a little bit of the whiplash, he goes, well, what happened here? And she goes, the horse's left ear was wiggling. I thought he was going to make a left-hand turn. So, I have two things for people to take home on this. One is that parents definitely have an impact. And this study in Amsterdam really brought it home to me that my mother's eating behavior had a definite impact on me. Subsequently, we certainly found out that she had, it was never diagnosed, and I've inherited part of that now, is where I'm food sensitive. I have some food sensitivities and I can't ingest certain foods, and it's probably genetic, but her behavior of that also had an impact on me. The second thing, take-home message is, every family has their funny stories, and some of them are hysterical, like this one. But my mother swore to her dying day, she goes, Rosellen, your father made that story up. That's not true. The first one was true, the second one wasn't. So you always should consider the source of the study, I guess is the other take-home message. So going at this from the lifespan, and it's not only parents having an impact on children, and especially when these neurons are being laid in the brain. But children can influence parents. We call it bidirectional. However, the scales are weighted very early on in child development so that biological parents and adoptive parents have most of the power. And shaping, as B.F. Skinner, if you've heard of them, some students take psych classes, it's shaping the environment. And that in turn impacts the development of these neurons in the brain, the synaptic connections. And, that's how we learn and take in information. There's a saying from the islands, one of the islands south of Okinawa, at 80, you're merely a youth. At 90, if your ancestor invites you into heaven, ask them to wait until you're 100. Then you might consider it. This is one area of the world where there's very long-lived people. These are called the blue zones. Dr. Nico referred to that on one of the radio interviews we did. And they have a different perception of aging, than kind of a Western view of aging. There's also, Loma Linda is thought to be a blue zone, a province in Greece. Is it Iona? Is that the pronunciation? Is thought to be a blue zone where people are living long, keeping very good eating patterns, good brain health, and living to a ripe old age. People who live to be 100 are called centenarians. There's 5,000 currently in the United States, and 1,900 of them live in Massachusetts. And I'm going, well, what the heck's going on in Boston and Massachusetts? And Dr. Thomas Pearls, who was up there a number of years ago, is head of that New England centenarian study, so it's very interesting to read that. Conversely, from more of a Western perspective and also reflecting history, Jonathan Swift, who is an Anglo-Irish satirist, observed everyone wants to live long, but nobody wants to be old. And do you think that still holds? Because he wrote in 1730 and 1740 when people didn't live as long. You were referring to that over the radio as well. But if that still exists, that tells us something that could be construed as pejorative for Western's culture and its view of aging. That it doesn't stand very well. Here, what I'm going to do too, and I'm going to have to move quickly here, so I'm going to try to hit the highlights of each slide. I want to lay the groundwork here to give you just a basic overview of aging. And even though I'm a lifespan developmental psychologist, I have to count on my faculty, or not my faculty, but my colleagues in demography, in biology, in medicine, in nursing, in sociology, and anthropology, to understand the complexity and the holistic nature of the process of aging. It's just not psychology. It's it's dealing with biological aspects of change. It's dealing with psychological, sociocultural, sociological, and life cycle. But I wanted to lay the framework because this is a series. And if you can only make this one, that's fine. I'm going to try to make the slides available for you so you can have a reference to them. But I'd like to think, too, I'm going to set the tone and also then set it for the next speaker, I believe is Dr. Kane, who talks about the gut biome, and then we're going to have Dr. Brittany Howell, who's going to talk about, again, as the dean referred to, give you some ideas of what we call mnemonics, how to keep your memory sharp. And then we're going to have Dr. Maria Crouch, who I'm so proud of because she's one of our Ph.D. graduates from psych at UAA, who is Alaska Native. We'll be talking more about the research and project that she and I have done and what we've seen. I'm actually going to talk about that briefly if I can get to it, the last slide. But she will have a deeper dive to that. So if you can come to the series, there'll hopefully be a coherency to it, which will hopefully help you understand what this entails. And then, also talking about how we in health area and we in psychology could help you deal with the vicissitudes of aging. The positive aspects, but also the negative aspects. So this is from colleagues, demographics, kind of gives you an idea of what's happened. Aging, you can kind of see on the slide here, I won't belabor the point, but the fundamental thing that has occurred here, and it really began, because I have a lot of history, and I'm also talk to history colleagues. A lot of the changes in life expectancy, especially here in Western cultures, began in the 1840s. Then what happened with the Industrial Revolution, there began to be a switch in the focus that by, moving away from the notion biology is destiny. Everything that occurs to you is based on biology. The focus began to shift with the Industrial Revolution so that the focus now is really on social, cultural circumstances. Today we're referring to them as social determinants of health. So there's been a big shift theoretically and research-wise, at least in the scientific community. Unfortunately, the conceptions that people have of aging has not kept up with our research. But again, we might not have done a good job of communicating our findings. But basically, people are living longer. Also wanted to bring up and just let you know, in the AARP bulletin last year, they did a study with the National Geographic. And they talk about the new truth about aging. How Americans are redefining health, wealth, and the goals of longevity. This is wonderful, and I'll tell you what they found in a minute. But, basically we've been redefining aging for the last 30 to 40 years. It really, part of it was the baby boomers, but I began to see the redefinition of aging with my parents, and how they were vital and active, even though they had chronic diseases. Now, the study that National Geographic and AARP did really was looking at, and I'm sorry I hit this, looking at older people's perception of their health and then rating their health. Is it good, poor, fair, excellent, or whatever? And they found an interesting finding. This was just last year. The finding was this: people were very positive about aging, even though they might have had 2 or 3 different chronic diseases. They thought they were managing the chronic diseases very well, and they loved the idea, and here's one of the major themes of this presentation, is how professionals can help them slow the process of aging while still dealing with chronic diseases, because by slowing it, it gives people more time. It gives more time to interact with their loved ones. It gives them more time for planning, and I think that's wonderful what they found, because it does state and indicate really that things may be beginning to change at a public level, and that you can still live, as I call it, optimally. I like to use being optimal, like the Army's quote, be all you can be. Meet your true potential developmentally, physically, and mentally, and socially, and still have to deal with chronic diseases. The other thing is, with the slowing of the progression, it really means this as well. What we have always are trying to impress upon the public and people is Try to make behavioral changes which will then turn into positive outcomes for the operation of your brain and your physical functioning. Why? Because it's better if you can compress morbidity to the end of life. Now, what does that mean? That's a fancy term, it's a theory. What we'd like to see is that when chronic diseases occur, it happens right in the last 5 or 6 years of your life, okay? Because we're all concerned about people's quality of life. This is critically important. What we unfortunately have been seeing, chronic diseases occurring in younger people. This does not bode well for you younger people when it comes to how you're going to progress to the latter part of the lifespan. That means you're going to have to deal with chronic diseases for a longer period of time. So those are kind of the things that we're looking at and what I'd like to communicate to you. Here's some facts and figures specifically to Alaska. Okay, you know, but here's the elephant in the room. The elephant in the room has been COVID. With demographic data, what we've seen occur is the life expectancy, and especially in the United States, has shifted downward because of the decimating, you know, older people, and nursing homes got creamed. Older people, and I applaud you for wearing masks, by the way. Older people are still extremely vulnerable. People with ADRD, Alzheimer's, dementia-related disorders, are still vulnerable. This pathogen still exists. It's nasty. And think about this. I've always tried to tell my students, I truly believe age is not a causal factor. But a lot of times what you're reading is age-related disease. I like to think it's time. It's the time that's really nested, as we say in psychology, or incorporated within age. And with time comes your life experiences, your lifestyles. And if your lifestyle is kind of varied across the lifespan, beginning in middle age, it may have taken a toll on your immune system. Subsequently, that's why you're going to be more vulnerable, you know. But you can also see, for the young people in this audience too, if you get COVID, long COVID can be devastating. We still don't know the full impact on the brain. You know, I can't stand up here and tell you, well, I don't think you'll get dementia or Alzheimer's, but COVID does something strange from my reading, and I'm not trained in medicine, but I try to read up on a lot of medicine because I have to protect myself as an older person as well. You know, it does something to the brain, and especially even younger people who get it. There's something they call brain fog. So there's a lot going on here. Demographically, the Alzheimer's Association indicates that 8 to 10% of the current Alaska population is going to get Alzheimer's or is impacted upon it by now. The Alaska Department of Health, if you want to know what the state's doing, they're coming up with some good strategies here. They just received from the Centers, it's not the Center for Disease Control, but it's the section of chronic disease prevention and health promotion, a grant called BOLD. And this BOLD is going to provide services and it really expands prevention services for families that are taking care of loved ones that have Alzheimer's or other dementias, and basically hopefully help families that are impacted upon it. They just got the grant several weeks ago. So, and again, it's going to be statewide. So you should be seeing some of those services begin to pop up here in Juneau. Also, through the Mental Health Trust Authority, we have the Alaska Dementia Action Collaborative that's working and really very well and trying to, make sure there's services in place for families that have individuals that are afflicted with this terrible disease. I'd like to just go back for a second. I didn't realize this till I looked at the stats from the Alaska Commission on Aging, or the demographics. Your area, Southeast Alaska, continues to have the highest concentration of seniors. Again, they're estimating 1 in 4 residents in the region is age 60 plus. Okay. The next growth area for us in Alaska has been the Matanuska Susitna Borough in south central Alaska, which is north of Anchorage. Okay. So there's a number of reasons we want to have a chance to get into that. But here I'm going to advocate. Again, this is my, it's no hidden agenda with me. It's the agenda out there. Why you need to know about the lifespan. Okay, we have certain terms in lifespan development that also can be used when you're talking about brain health and development. Okay, plasticity is a notion that we talk quite a bit about in lifespan. This is referring to people are not static beings. They engage with the environment. They learn. They store information. You know, your capacity is not predetermined. You know, and again, for me, as I was telling Dr. Nico, is that, you know, for me, the crime is, if there is a crime, if you can say it that way, when people don't reach their full potential. You know, their genetics, their biology, and the skills that they've developed, and, you know, they don't reach their full potential. But plasticity certainly is important here. You'll see it with brain growth. Neuroplasticity is called, and you'll see the research in a few minutes on that. Historical context. People do not grow in a vacuum. You are products of your genetics, which is, you know, things going on at the cellular level. You're products of your biology, your physical aspects. You're products of psychology. You're products of, you know, all of these aspects. But history also plays a major role. The cultural, historical fabric that you're raised in has impact on you, okay? And a lot of times that's not factored in. Multiple causation is very important here. There's a number of things that will cause things to occur. You know, it's a wide variety of forces. Again, it's the notion of biology and psychology aspects, then life forces, things sometimes you don't expect that may have caused something to occur in your physical functioning or your brain growth and development. And then here's the most important one. All of them are important, but this one especially, multidirectionality. When development occurs and when aging occurs, it's made up of gains and losses. What's going to happen, as you'll see in a few minutes, with the evidence that we have, is that as your thinking changes, you'll be reaching higher levels of thought, but then you may lose something at another level. I was telling Dr. Nico, with my father, it was always, I was so excited as an undergraduate. You know, I said, wow, this is really good. So I come home, talk about Freud. I was going to Ohio State then. Go Bucks. But sorry, she's from Michigan. You know about the rivalry there. But, and I come home, and, you know, my parents were quite proud of the changes mentally that they saw in me and my thinking, and, you know, and again, very reliant on what we can't see happening in the brain with these connections and of the neurons. But my father always brought me back down to reality, and he says, well, that's fine about Freud, and that's good about Erickson and all this. He said, but how about bringing all that down to layman's terms for me? So here I was advancing intellectually at, you know, one level, but I was losing the ability to communicate it appropriately to someone that didn't have the background. So that's what we're going to talk a little bit more about to set the stage here. These are some other terms we have in lifespan development: cognition, about the process of knowing, and talking about how you develop skills and knowledge, very reliant on what is then going on underneath in the brain. You have skilled motor behaviors, perception. We were talking about art earlier and the perception of art. That's tapping into the brain. That's tapping into certain areas of the brain. Decision-making, goal setting, planning, and judgment. A lot of that is what we call executive function. It's in the frontal part of your brain. Okay, now the whole brain operates together, certainly, but it does have distinct functions. And as the child progresses across the lifespan, the brain actually becomes more specialized as the child interacts in the environment And as parents make things significant in the environment, what's going to happen is the child is going to start these neural traces to form. And at certain times of the lifespan, because they have so many neurons in dendrites up there, what are called, they're beginning to prune those, which means like you prune a tree. The brain is fantastic. The body is fantastic. We don't know why this happens. But if the parents are having something highly significant in the environment, the child is attending to it, they're going to lay the neural trace, but then the pruning gets rid of the neural traces that the child is not using. Here's where the role of the parent comes in. My brother was relating, experience he had. He has friends, and he says, "Oh my Lord," he says, the son plays football, the daughter is excellent in violin, and the 6-year-old began to play the drums. Well, the parents were probably kind of in tune to their child and saying, let's give them this experience. And they began to excel. The young woman, who's playing the violin, there's enough evidence to indicate violin players, their brain is structured slightly differently. You have a left and a right hemisphere, and then the connection is the corpus callosum. In violin players, the corpus callosum, which is a nerve fiber, is larger. So think about it. You're playing the violin, it's motoric. And memories can be stored in multiple areas of the brain. The hippocampus is probably the major one. And then emotional aspects, and what affected my mother was probably that she got so fearful of seeing that chicken decapitated, her amygdala kicked in. And then that in turn worked with the hippocampus, and that went up to the prefrontal cortex, and they said, stay away from chicken. It's like a big red light. Stay away from chicken. Stay away from chicken. Psychologists are looking at trauma. It'll be interesting to talk to your husband tomorrow. Trauma and what happens in the brain when people are traumatized. A large part of that really truly is due to what part of the lifespan it occurs, because it will have a differential impact, a traumatizing event, on a child versus an adolescent, and it differentially impacts then somebody in adulthood. When 9/11 happened, the American Psychological Association came out and was letting parents know and giving them advice of how you should really explain this event. Young children will not understand it because of where their thinking is. So that's critical to understand from a lifespan approach. Some of these events differentially impact, according to where you are in the lifespan. In some parts, it will have devastating effects on the brain. In other parts of the lifespan, it may not, because your brain is, developed. And for younger people, I think your brain is about 3 pounds, and you reach the full growth of the brain and its potential with respect to volume at about the age of 25. So think about that. Childhood, up until the age 25. The concern also in Alaska now is, I'm not picking on young people, but I want you to be aware of what you're doing to your brains, the potential harm. Fentanyl is a huge issue. We've had a number of deaths in Anchorage. And young people are buying drugs, to calm down, deal with anxiety over the internet. And there's unsavory individuals that are adding fentanyl. And it's not only a crisis up here in Alaska, but it's also in the lower 48. So please be careful, But these are just terms that we have: cognitive vitality, keeping good cognitive function. Here we go with the terms again: neuroplasticity, brain plasticity, the ability of the brain to change in response to stimuli. There's enough neurocognitive evidence coming out now that indicates even into advanced old age, you can continue to produce neurons. This is amazing. I mean, I get so excited about this. It's just, I always have to, I was telling Dr. Nico, I always have to refresh myself on the brain, because it's not something that would be intuitive to people in lifespan development. But the fact that they're finding this is further support. You can make behavioral change which will impact your brain. We've never seen this before. The science is moving quickly, okay? And that's where you talk about neuroplasticity, neurogenesis, generating neural neurons and it's really from the adult stem cells that you have. But it also takes your interaction with the environment, Aging well depends on your genes, environment. It's multiple causality here. And again, talking about healthy lifestyles, why that would be critical. And also multi-directionality, With aging, it's not decline, it's gains and losses. It's gains and losses. And so it's not in a strict linear view where it descends, you're losing functions for things. And now, just briefly, so we can move on, I want to make sure we have enough time for questions. In psychology and lifespan development, we talk about intelligence, and there's really two types for us. There's fluid and crystallized intelligence. This has to do with skills and knowledge that you acquire as you interact with the environment, as children go to school, as they socialize with their playmates. They're, learning about each other, but they're laying down the neural paths. And fluid intelligence for us, and what the evidence indicates, it's really neurologically based. And so this really deals with such things as word fluency, spatial visualization, perceptual speed and reasoning, and these tend to slow down as you progress across the lifespan. Again, if you notice, I'm purposely trying to avoid age because I don't think it's a causal variable. There's a lot tied up in it. But in society, we tend to think everything has to be chronological, at least Western society. And then crystallized intelligence continues to grow and develop. Vast advances in it. So you're talking about changes in vocabulary and those types of things. School learning, a lot of that, is really dictated by your engaging with the environment. And so there's these types of differences that also need to be considered. The bottom line here for crystallize, then, too, is also the developments of what we're going to see in a minute here is wisdom. Okay? What's a wise person? There's various definitions for that. Everybody has their own definition of who they think a wise person is, but there's pretty much a consistency. And many of these people are accumulating knowledge and skills, life experiences, okay? And they're becoming more mature in their thinking as they progress across the lifespan because of their openness to new experiences. Sometimes personality plays a role in here. Are you a person is rather open to new experiences or you're kind of shut off? That may have an impact as well. So there's a shift in thinking here that occurs. And again, this is dependent on brain functioning. So there's a connection, a very important connection for us in lifespan development. Here's some of the things that we refer to as universal changes that may not be modifiable. Speed of processing is one of the most consistent ones. How quickly you respond. That seems to be universal, okay? That is also kind of trying for people sometimes because, when you're driving, you need certain skills where you're going to react fairly quickly. And so this is tough for families sometimes to have a talk with their elder parent and say, it might be time to take the keys away, because it's a real sign of independence, especially in Western societies, at least ours. So this brings up these types of issues. Decline in working memory seems to be universal. This is really short-term memory. It's a process. As you're sitting in here, information is coming in. You're hearing me blab on, gas bagging, as the Australians would say, and you're attending to certain things. You may not be attending to other things, and then it's going into short-term memory, working memory, and then some of you are writing it down, so that will help you get into long-term memory to spit it out later. Okay, but that seems to decline with age. In psychology, it's the famous dictum of 7 items plus or minus 2, if you've taken a psych class. How many items can you keep up in there and then realize, I've got to do something with this. I've got to get in it. I've got to memorize it for my psych professor with our exam. So I got to get into long-term memory. What are the best strategies for me to use? That does tend to change with age and as you progress across the lifespan. And there's certainly other types of changes that are consistent as well, but those are the 2 most important kind of consistent ones that everybody's going to have to deal with. Unless, and here's the caveat, you become part of an experiment where they're doing cognitive training. There's some evidence that you can train people on this, and older people to do better and perform better. What would that mean? Doesn't it mean it's plastic? And that some of our notions of aging are hopefully will fall by the wayside with this. And some developmental advances and crystallize about how people think. Again, this notion of wisdom. I'm going the wrong way. Now, possible causes or conditions of memory loss. You can see up here, poor nutrition. The gut bacteria that Dr. Kane will be talking about. I'm extremely interested in that because of my food sensitivities, which I know is genetic. So I have to be extremely careful of what I ingest. And you know, because when I ingest something that doesn't agree with me, and it may trigger off my asthma, I don't feel well. And I'm not cognitively on top of things. I really feel that, you know, it's really impacting my brain. Dehydration. Are you drinking enough water? You know? I don't know if that's changed over the years. Hasn't it been 8 glasses? Where's the doc in the house? You know? And unfortunately, Cokes and soft drinks don't really count. You know, to stay hydrated because it's got too much sugar. Fluctuating in blood sugar, diabetes, thyroid deficiencies, infections. My mother was in the hospital, and I came in, this is probably 30 years ago, and I go, oh my God, what's going on with her memory? You know, something's happening. And I talked to her physician, and he goes, it's iatrogenic. And I said, iatrogenic? And he says, she's been in the hospital for a period of time. She hasn't, you know, seen a newspaper, and she hasn't been stimulated intellectually. And, you know, he says, I think once she goes home, her memory will come back. That's exactly what happened. You know, medication combinations, and boy, depression and anxiety. I just have depression up here. You know, when I was teaching full-time, we would talk about this in class. You know, depression, when you're depressed, it can mimic a cognitive or a memory disorder. It's because of the parts of the brain that's being impacted by depression, you know, and anxiety. And so if it goes on for an extended period of time and you can't get it controlled, it can have some irreversible changes in the brain. And that's why it's always good, you know, for people to check in. You know, during this talk too, I was thinking that sometimes people are very reticent about talking to their healthcare provider about changes in memory. Sex happens to be the other one too, but memory, you know, but don't feel uncomfortable about this. If you feel something is going on, you need to address this and bring this up, because the earlier they can diagnose what the cause is, the better, I would probably say, the prognosis, you know? But many people are reticent about doing that. They're embarrassed, you know? But you don't want even mild cognitive impairment to occur. You know what? In the years past, when I was lecturing, we used to talk about the continuum. So you had mild cognitive impairment with a few problems with memory, and then it would progress to the intermediate stage, and then it could really progress to the full florid symptoms, which really is, be unable to come up with a word, aphasia. I believe that was happening to Bruce Willis. It's the frontal temporal or frontal dementia problem. And, aphasia is the inability to find a word, to speak, to understand speech eventually, and it can progress to really severe outcomes. And then in some aspects of dementia, it can progress to severe personality change. When we had the Geriatric Education Center, one of the things healthcare professionals, and this is training healthcare professionals in how to deal with older people, basically. We had a number of healthcare professionals, and especially in nursing homes, going, I don't know what to do with this patient. They're very aggressive and they're striking out. That's what happens when you get to that latter part of the ADRD or the Alzheimer's syndrome. There's huge personality changes, and it's hard on the nursing profession, on the caregivers. We don't know how to deal with these aggressive behaviors, so we always try to give suggestions of how to deal with that, which usually helps. But you also have to consider the individual person you're working with. One person, if I remember the story correctly, was a farmer originally. So he was used to getting up at like 5 o'clock in the morning, which I think you go out and milk cows. So he's in the skilled nursing facility, and he had Alzheimer's disease, and he kept getting up at 5 o'clock in the morning, and he'd get agitated. I gotta be outside, I gotta be outside, I gotta be outside, I gotta milk the cows, And finally the staff realized, I think we can control this by getting him up at 5 and said it's time to go out and milk the cows. And they got him ready, took him outside, brought him back in, and he felt much better. He was less agitated. He had done what he needed to do, which was his occupation, and he loved his occupation. Some other things, sensory loss, lung disease, cancer. The big one, 2 of the big ones, lack of sleep. Which I've been having an issue with. I'll share that with you because I've had so many presentations. But according to a study in 2016, 1 in 3 people do not get enough sleep. I think the sweet spot for sleep, as we're going to call it, the optimal amount of sleep for most people is going to be 7 to 8 hours. And I believe it might have been Bill Gates I was reading, and I might be wrong, but I thought the article was about Bill Gates, and he said, boy, he has regrets. When he was younger, the goal was, amongst his friends, is how little sleep you could get. And even as a young person, that can have an impact on you, and it has an impact on your brain because you need restorative sleep, for your body, but especially your brain. Lack of physical activity, oh my goodness. According to the Center for Disease Control, only 1 in 4 people, or 1 in 4 people are not physically active, okay? So 3 people are, but 1 is not active. The World Health Organization estimates 80% of adolescents, this is worldwide, 80% of adolescents and 27% of adults do not meet the recommended level of activity, Also, the big one for us now is social engagement, especially with the elephants and COVID, where people had to remain isolated. This social isolation affected older people and is still affecting them, but it also affected school-age children. When you took the children out of the school and you brought them home and had them look at the computer to take their lessons, they lost some of the enrichment that they were getting as a result of interacting with their peers. We've also seen a rise in depression and anxiety in children. Yeah, the COVID has not been friendly to anybody, and it's been a challenge for a number of people across the lifespan. Brain pathology, you can see something here what we're seeing about Alzheimer's disease, because I need to get to the remaining of the slides, so we're running late, about the number of individuals that have Alzheimer's and the cost. You know, I hate to reduce things to cost, but that's invariably what it comes down to a certain extent. It's not only financial cost for families and healthcare, but it's also the cost of family caregivers and the time they're devoting to taking care of loved ones, you know? So it's a number of different things here. You see 3 in 9 American Indian Alaska Native people 65 and older will develop dementia. Dr. Crouch will probably go a little bit more into that. And other types of statistics. Alzheimer's disease, you see here an MRI, I don't want to stray too far from the microphone, but also PET scans. On the right-hand side would be the brain with the pathology, and on the left side is the one would be typical. And so you see these changes in it. Again, the known risk here, and again, I hate that they put age up there, but you have to be practical about this. The longer you live, as I say, the more likely you're going to get nailed by something. And some people are going to get nailed by an organic brain disorder. Genes, the ApoE4 allele is thought to be the culprit genetically. People who have inherited this are more likely than to actually suffer from the disease. But the research is moving quickly, so I wouldn't be surprised if they're going to have a lot more information on why that's occurring with that particular allele. That's, again, part of your genes, your gene makeup. TBIs, head injury. My concern has always been with young people in the military that were overseas fighting and, you know, were in a Jeep and were in a car accident and hit their head. TBIs can make people vulnerable to Alzheimer's disease or other forms of dementia later on. Football players, just read recent research on that. A survey, a small survey, I think it was 1,000 people, but 60% of those people that had played football were beginning to show some strange motoric changes, and that's more a sign of Parkinson's disease. And so that really has a lot to do with the cerebellum part of the brain, which is more in the interior part with Parkinson's. And we're going to keep harping on this about the suspected risks, why you should watch and always check with your physician if you have cardiovascular disease, high blood pressure. Boy, and then the big ones again, physical exercise, depression. And I like to state that the research is moving quickly. We now have 2 new drugs out that will slow down the progression of dementia. The caveat here, or the exception here, is that these drugs will be prescribed only to people who have mild cognitive impairment. So it can't be used with, these drugs are not going to be used with people who have advanced issues. I think that's critical to understand, because they're establishing guidelines now for physicians and nurses of how to go about distributing these drugs. And then you have to really do a lot of monitoring of the drugs through PET scans. Also, some of these drugs are not inexpensive, but Medicare will pick them up. Medicare will start to pay those. So again, a lot of different things here. This is just looking at what a normal neuron is, and that's what we're talking about, is what makes up the brain, and certainly what forms in childhood. Even actually it begins to form in utero with maturation of the embryo. But then we also see on the other side what happens with a brain that's not quite operating optimally, and you have what are called neurofibrillary tangles form on the neuron, and then plaques that are in between it that can really throw a monkey wrench into the communication and these electrochemical impulses. That's how your brain is working. finding your sweet spot, okay? And I'd like to also suggest if, nobody can make behavioral change on their own. It's hard, I always, backslide. I ate something last week and I go, why did I do that? That I wasn't supposed to, and I didn't feel good after that. And I thought, gee, this is really kind of dumb. At my age, I keep doing this stuff. Even as we say in psychology and animal research, even the animals have bait shyness. If an animal eats something, they ingest it and they don't feel right about it, they don't eat it again. What is it about humans that, oh, I've got to try it again? The tiramisu looks so delicious. And it's like, you've got to be kidding me. How many times does somebody have to beat you over the head? And I'm talking about me. Stop ingesting it. But everybody's going to have your own sweet spot. What you're going to find works for you. But I wanted to tell you that you can also check out the Alaska Department of Health Fresh Start program. This program launched last year. It's a free program for the residents of Alaska, and it can match you with coaches, health coaches. It offers instruction and distributes health products like blood pressure cuffs. Take advantage of it, The state is really, I think, coming up with some really good programs that are here to support you. But if you don't know they're available, you can't access it. Yeah. Again, reiterating, you see I'm using basic psychology here. The more I put these slides up, some of them have the same thing. I wanted to get it into long-term memory. A study in the Lancet Journal, which is more of a medical journal, indicated 40% of dementia cases are attributable to the following modifiable factors. Okay, high blood pressure, obesity, physical inactivity, diabetes, smoking. With smoking, more and more research is being done on cannabis use. It's a form of smoking, isn't it? And especially with teenagers. Now, they're finding that teenagers, especially in that critical period of pruning of these neurons, which there's one phase in childhood where the pruning occurs. There's a second one that occurs in adolescence. And then you have adolescents and smoking or using fentanyl right at a critical, we call it a critical period. And if it's happening at a critical period, it could have immense impact on the brain. Okay, teenagers, the preliminary evidence coming out is that teenagers who use cannabis in a recreational way are 2 to 3 times more likely to suffer from depression and suicidal ideation. Whoa, and subsequently, some teens have cannabis use disorder. I've never heard of it before until I was doing the research on it, which means they can't stop using it despite health and social problems. Subsequently, they're 4 times more likely to have the same thoughts and feelings, depression, suicidal ideation. Brain health, what you can do, get recommended health screenings. Again, manage your chronic conditions if you have them. Consult with your healthcare provider. I know that sometimes it's hard to get into see them because of, the pandemic and what happened with the pandemic. But you want to make sure the medications you're on are correct. The dosage is correct, especially. And especially as you get older, you don't need as much of a dosage sometimes. There's a slight printing error in here, but talk about watching falls, especially when you're older. If you fall and you hit your head, it could have some unexpected consequences for your brain. Also, younger people, if you fall. If you're skiing and boom, you fall, could have some unintended consequences for your brain. Certainly, smoking is up there. Now, again, we're back to diet, staying active. And Dr., as I said, Emily Klein will take a deeper dive on that, October 20th. But here's what people are recommending universally for people. Again, You need to figure out what's going to work for you. For me, I'm limited because of the nightshade vegetables. So I have to be picky even with what they're recommending. And adequate fluids comes up again. Here, staying active, very important. What they're recommending is 100, these are exercise specialists, 15 minutes of exercise each week. And, you can vary that. Walking is a good start. Maybe you like to dancing, because you're also moving motorically as you're dancing. And that's also having an impact and exercising your brain and the cerebellum, where a lot of motion is being really, it takes place. And then always check with your healthcare professional on anything you're going to do. Dr. Brittany Howell certainly will be talking about more of this, the little things that you can do to improve your memory. I can tell you the one thing, basically. I've had people come up and say, well, what do you think about Sudoku and word puzzles? I said, well, they're great. I said, but how often do you do them? They go, I've been doing them for years. And I thought, I'd like to make a suggestion. You can keep doing them, but choose something that's novel. Novelty is the trick. Something you're not used to doing. That's going to challenge the brain, and it could possibly form new neurons. And those in turn will form new pathways. So it's novelty that is really critical when you're deciding to do something. And being social too certainly is critical. With respect to engaging with others and doing fun things with them, or even having interesting discussions or book clubs. That's also a form of engagement. And here's just one quick study on superagers, talking about what research is finding. And this is a study from the University of Spain, and talking about they don't have as many changes. They've been able to slow down some of the changes in the brain with what is the white matter and the gray matter. The gray matter is what contains these axons and dendrites, and the white matter has to do with more of the electrical chemical impulses that shoot through the brain and then go through the central nervous system, say, I gotta move my leg, And so we're seeing less a decline in these people. And these are some of the other results. Now, this is self-report research, and sometimes there's problems with people, self-reporting this. However, it's good data for people to continue to try to replicate. And also, they suffer less from depression and anxiety. These are people, too, that to a certain extent have really positive outlooks on things. Negativity weighs down on people. And also, when you're more positive, people like to be around you more. We always talk about that in clinical psychology. When you're depressed, you're like, I don't want to be around that person. They're kind of a downer. Debbie Downer, that's what it was. I don't know if you ever watched Saturday Night Live. Debbie Downer was on, and she'd always go, everybody is in a good mood. I think they were at Disneyland. And we'll go on this ride, we'll go on this. But did you ever think about the danger of going on these rides? And then she goes on, and by the end of it, everybody's going, let's leave the park. And she had a huge effect on their behavior. So, one last thing here, I'm going to move to our project here, is just to reiterate what we're seeing, and again, with respect to utilizing a lifespan view, is health at any given point in the lifespan is influenced by what somebody has done earlier. And I think that needs to be recognized, because that gives you more information to help people make behavioral change in a positive way. And also, too, talking about perceptions of what constitutes health and health-related issues. We'll see in a minute, and hopefully I'll be able to conclude, about what we found with Alaska Natives and caregiving, especially with respect to dementia. That much of that can also be related to people's view of the lifespan. What was imprinted, I'm going to use Conrad Lorenz's term, and he was very famous in animal research and psychology. where he studied the ducklings that, if they were taken away from their mother at a very early age, they would follow a human being because the mother was there. They imprinted. There's a critical period for imprinting. We call it bonding and attachment for adults and children. But so there could be a critical period for some of this as well. And then, again, neurocognitive losses and gains with age. What I want to conclude with, and thank you for your patience, is a project that we did. It started in 2015, actually as a class project. And Dr. Maria Crouch was taking the class, and she and I collaborated on this. We're really interested in looking at Alaska Native elders' perception of memory and caregiving. I'd like to thank at this point Elizabeth Sunnyboy, who was our cultural advisor, and also the people of the Yukon-Kuskokwim Health Corporation. They really shared their wisdom with us regarding their view of the lifespan, which indeed then impacts their understanding of dementia, and in turn impacts their caregiving of their loved ones. And so this is really showing you what we came up with respect to, this is not a linear Western view of the lifespan. A linear view would go, would be linear, and it goes from, it's based on age, and age is used in an index to help us understand what's happening during what period of the lifespan, and what would be the critical period of that. Again, with brain growth and development, the critical periods are in utero with respect to growing neuronic types of factors, but also age 2, and then in adolescence again. These are critical periods. But from this perspective, age, this is, I think, found fascinating, age is taken out of the equation. And instead, we're talking about quadrants here. And what the focus of at least this Alaska Native tribe in the Yukon-Kuskokwim area is really finding is important to pass along to the next generation. And also, as I said, this view impacts their notions and their beliefs regarding dementia, and also will impact the caregiving. And, caregiving now, and what we found is much more sophisticated than even people who spend a lot of time studying it. That it can be really impacted upon by how you were socialized. What was important in your culture? What was important in the society? What was important that your parents highlighted for you? Okay, and so you see it here as quadrants and not chronological age, and you see the importance of who you are, teaching on love, and then it's broken down into those other components. Stories, generative healing, okay, caregiving comes in there on quadrant 2. Quadrant 3, historical change. I talked about the role of history. The role of history for Alaska Natives has been extremely important. And then Alaska Native spirituality. We don't do a very good job in psychology, and I'm willing to admit it, understanding the role of religion in people's development and spirituality. I think we need to spend really more time on that because it really does impact people. And again, it will probably impact your care of a loved one, especially when it comes to Alzheimer's disease. And then in these circles here, what we're also showing is that there's a number of Western theories in lifespan development that actually supports, what Alaska Natives are talking about. So we're trying to bring together Western theory, research with Alaska Native, because Alaska Natives, we found in this project, feel that in order for them to stay healthy, they have to have a balance. They walk in two worlds. Subsequently, they have to balance traditional ways of knowing with Western values. They're quite, alert to this. And so she will, again, as I said, take a deeper dive, Dr. Maria Crouch. But I like to end with this comment here, if I can progress this slide, and I'm going to read this. This is by Eric Erickson and his wife Joan, who was his writing companion. He's truly what we call a lifespan theorist. I think he nicely incorporates and captures what he was going through with respect to his aging and how it relates to his 8 stages. Life in old age requires courage to change one's life in accordance with acknowledged values, to plan one's future in spite of the shortening time perspective, and on the other hand, the courage to deal with adversities and with the growing limitations of the physical, mental, and social spheres. Courage arises from the daily struggle between involvement and resignation. Courage also appears in the last life stage when complemented with wisdom. It enables a human being to face illness, suffering, and death, and to come to terms with their own past. My last thought here is this. Please be kind to your brain. Be kind to your body. Be kind to your health provider. These people have dedicated their lives to understanding the body and the brain and how the two interact. Also, I think that you should view them as a resource. I'm going to make their jobs even worse, probably. They're going to kill me. The fact is that they can be used as a resource to help you deal with what I call the vicissitudes of aging, so that you can truly understand the things you can change, the things you cannot change, and to really know the difference. So thank you.
Pop this out. Thank you so much. If anybody has any questions, we're happy to run the mic around. Great, I see a hand over here and a hand over here. I'm gonna give it to you first here.
I was just wondering, have you seen any research done on the effects of vaping in the brain? I know that's epidemic in some communities.
That's an excellent.
I got you.
You got it here. That's an excellent question. In preparing this presentation, I didn't run across the data on that, but I know that they're investigating that now. And if they're finding that with cannabis use, I can imagine what they're going to find with vaping, because you know, when that first came out, everybody thought it was a healthier alternative to smoking. And all of a sudden it's like, you know, and then the flavors that they're putting in there. I think also I was just reading the FDA is beginning to investigate vitamins and other things sold in pharmacies that, you know, are flavored, added. I notice, you know, taking melatonin, I go, oh, they got gummy bears, you can chew them, but that may not be good. You know, but I'd have to look into that. So let me think about if I find anything, I can share it with Dr. Nico, and then we could pass it along. But I think you're right. I think that's going to be the next big area besides cannabis use.
Also, hang on. Here we go. I also wanted to say, well, this microphone might be a little rough.
Here, you want to use this one?
I do. I'll run it back and forth. I'm good at this, I promise. All right. Also, while we're doing running around and doing questions, please go get snacks, cookies, fruit, veggies. Feel free to get up. Let's make this casual. Okay, here you go.
Oh, yeah. Hey, thanks for your talk. On your slide on crystallized thinking, it said that thinking is a social enterprise. I don't know what that means. My second question is on your slide on 40% of dementia patients, that mental activity was a risk factor. I don't know what that means. Thank you.
Let me go back and see if I can find that one. Let's see.
I think he asked about crystallized.
Yeah, there's the crystallized
memory.
Well, I think with crystallized, basically, it's indicating that it has a lot more to do with interaction in the environment versus something that is coming from the brain, which is more fluid. So there's a kind of a social engagement interaction component, because when you're going to school, you're learning, but you're also interacting with other people. And so it has a lot to do with kind of that environmental component that impacts the brain. As you're going to school, or you're interacting, or you're in a book club, you're still learning. It's a different type of learning. And it also is impacting a slightly different part of the brain.
So that's qualitative.
Yeah, I would say it's more qualitative. That's an excellent question. The other thing I'm trying to think, what slide was it?
Oh, it was a slide about 40% of dementia patients had risk factors, and one of the risk factors was mental activity, so I was curious.
Oh, okay, that might have been an error, so let me see. I think it's down. Oh, there it is, okay. Okay, it should have been mental inactivity. Thank you. You were paying attention, thank you.
I saw another hand. Okay, I'm going to go back there and then here.
Thank you for taking my question. One of the questions that I have is the nicotine aspect kind of with vaping and tobacco use. You know, we know that tobacco smokeless can affect your gums, and with smoking it can affect your throat and your lungs. But with these new flavored nicotine pouches that are coming out, how can that nicotine affect your brain health and also memory?
I'm getting this mic back to you. So another question about nicotine. Did you hear that?
Yes, I did hear that about nicotine and with smoking. Actually, I might defer to Yep.
Sarah, I'm going to give this to you, just especially for people online. It's the only way they can hear you.
Well, constricting blood flow. So anything that reduces blood flow to the brain is ultimately going to impact your brain. So vasoconstrictive, meaning it's reducing, the size of the blood vessel. So you don't want to reduce blood flow to your brain. You want to optimize that. So even things like inflammation, chronic inflammation is a risk factor for that as well. And so if you think about smoking and all the toxic chemicals in there, it's just this rabbit hole and cascade of things that occurs. So optimizing blood flow, things like exercise, hydration, all those are extremely important.
Thank you for the question.
Thanks, Sarah. And I saw right here. I'm going to come up. Thank you. Right here.
Thank you so much. Could you go back to the slide that talks about the new program? It's the Alaska Department of something that matches people with coaches. I'm sorry, I didn't quite get to write that down. And then I had one other. While you're looking for that, I just wanted to comment about, you mentioned that we weren't sure why we do neural pruning. Health Fresh Start program. So there's been some really interesting research showing that kids on the autism spectrum disorder between ages 5 and 17, so most non-autism spectrum disorder kids have had about 50% of their brain pruned, basically, of the neural pathways, whereas with autism spectrum disorder, it's only about 16% pruning. So it's just kind of like this TMI thing. It's like, we can't handle all the information, and it's better to do pruning.
I am. I learned my steps. Thanks, everybody.
No, I think I just actually read that about the autism spectrum disorder and the pruning. And I think there was also a connection with schizophrenia. What happens with pruning? You brought up a really good point. Yeah, and what we see with certain types of learning disabilities, that there may be a disruption in the process of pruning makes a lot of sense. Again, why that happens, I'm going to conjecture here that it could be have something to do with genetics too. Because with genetics and alleles, and you're getting mutations sometimes. The mutations in your genetic code can come from parents, but it can also be due to coding errors that occurring as the embryo is developing and then moving into the fetal stage. And I would tend to think that it could be a genetic, issue that has to do with a coding error. It's inherited from the alleles from one parent as opposed to the other. Because you get one allele from one parent, you get another allele, and that's part of the gene makeup. And you could have homogeneity and heterogeneity and all these other things. If you have one that doesn't match the other and one, becomes dominant over the other, the child will inherit it if it's recessive. So it gets into this kind of genetic explanation.
There were one and maybe two places in there where one of the slides talked about memory training for older adults or cognitive training. Could you go into that in a little more detail?
Some of those things that I mentioned, like with working memory changing, it seems to be universal. Speed of processing is a universal type of thing that may decline. There has been psychological researchers that I've looked at trying to train people so that they can keep the short-term memory working in such a way that they can continue to bring information in and store it. And it varies with the type of training they're going to give. A lot of it has to do basically with just setting the person down and having them keep rehearsing things, providing strategies. Let's give you a comment or a suggestion of maybe what you need to selectively attend to in an environment, okay? And then how to utilize that to get it into long-term memory. So there's various techniques that they use for cognitive training. And they really give you strategies by which you can change some of that wiring, which will have an impact on some of these universal changes. And again, speed of processing is one. One of the things that I found with speed of processing is that because I'm more of a type A personality, I've retained my ability to move fast. One of the other signs, certainly, that they're using, besides these biomarkers, with blood, they actually are working at several universities finding there may be a test to test your blood for Alzheimer's disease. If that comes up, this is going to be earth-shattering. Because basically, you really can't get a good handle on it unless, you have an autopsy on it. So they're getting better at looking at these other biomarkers. But one of the other things years ago, and I found utterly fascinating, is they were looking at people's walking, gait. They also use that now as an assessment in the clinic. How are you walking? How quickly are you walking? And, there seems to be a relationship between people who are having problem with their gait, how they walk, and what's happening in the brain. So that's an excellent question. So yeah, there's wonderful cognitive tests out there. I should also mention there's assessments for mild cognitive impairment. It's called the MoCA, Montreal Cognitive Assessment Scale. And if you are thinking you might have mild cognitive impairment, but remember, it can mimic, it could be depressed. You could be depressed. It doesn't necessarily mean it has to be a full-blown problem with memory that's due to some kind of thing occurring and changing in your brain. You can ask your physician or who else to give you the MoCA, and that will allow them to distinguish if your mild cognitive impairment really is something that should need to be concerned about, or it is really due to something else. It could be medical, with mild cognitive impairment. And think about it, when you're in the older age range, you have a lot of losses. It's easy to get depressed,
Any other questions? Okay. Thank you all so much for joining us this evening. Our next evening at Egan, do I have the date on me? I think it's October 23rd. Somebody correct me if I'm wrong. It is Dr. Aaron Hood is going to be talking to us about, he's one of the experts that researches the flood at Suicide Basin, and he's been researching 27. Thank you, Gloria, you're the best. Thank you. That is the 27th of October. And Dr. Aaron Hood is going to be here. And it's he and his colleague are going to be here talking about their research and also what specifically happened this year. And I hope that the community really comes out for that conversation. I think it's really important. And as I'm sure many of you know, folks that were affected by that flood this year. So please come out and join us for that conversation. Thanks so much again for coming this evening. If you're still hungry, grab another cookie on your way out. Take care. Get home safe.